Hi everyone, welcome to this short tutorial from Pathology Made Simple at ILO Pathology. This is the part 3 of breast pathology series which I am covering for the undergraduate students, the medical students. In this part, let's learn about the stromal tumors of breast, the benign stromal tumors of the breast, which includes fibroadenoma and Phyllodes tumor. This is what we'll be discussing in the next 5 to 10 minutes. We will talk about the stroma of the breast and then we will discuss the tumors of intralobular and interlobular stroma. So when I was discussing about the normal anatomy, I think we did discuss about the two major structures, two types of epithelial cells and the two types of stroma, right? And the stroma are the interlobular stroma and the intralobular stroma. So this was the illustration which I had showed, right? So the stroma which is present within the lobule is called as intralobular stroma, and the stroma in between the lobules is called as interlobular stroma. Okay, another illustration showing intralobular stroma within the lobule. In between two lobules you find interlobular stroma. The tumors which arise from intralobular stroma are the Phyllodes tumor and fibroadenoma. Okay, they are also referred to as biphasic tumors. That's because they also include a non-neoplastic epithelial component. Because you have a stroma and then this is epithelial component which is tightly intermingled, right? So the tumor do include a part of non-neoplastic epithelial component, and that's the reason why they are referred to as biphasic tumors. See, the growth factors from the stromal cells, they help in proliferation of these epithelial component in these tumors. Okay, so the epithelial component grow by the growth factors which are released by the stromal cells in the intralobular stroma. Most often, majority of the cases, there will be mutations in MED12 gene. The tumors which arise from the interlobular stroma are lipoma, angiosarcoma, myofibroblastoma and fibrous tumors, the angiosarcoma being the malignant tumor. So let's learn about these two tumors, fibroadenoma and Phyllodes tumor. Fibroadenoma is the most common benign tumor of female breast. It can occur at any age, but most patients, they are young and in their reproductive age group. 2/3 of fibroadenoma patients do have mutations in the MDM12 gene. Clinically, fibroadenomas presents as solitary, freely mobile lump in the breast. And because of their high mobility, they are also referred to as mouse in the breast or breast mouse. They can be multiple and bilateral. They are the hormone sensitive tumors, which means they grow during pregnancy and they regress after menopause. So grossly, these are well circumscribed tumors, often measuring around 3 to 4 centimeters. Rarely they grow beyond up to 10 centimeters in diameter. The cut surface is very characteristic. It bulges above the surrounding tissue and it is firm, grayish white in color and glistening. Sometimes you do find slit-like spaces. So microscopically, it contains a mixture of epithelial and stromal tissue. That's why it's called fibroadenoma. The stromal component is usually predominant. That is made up of fibrous tissue. This is arising from the intralobular stroma. Whereas the epithelial component is composed of the ducts which are lined by regular double-layered epithelium. Okay, based on the growth of the fibrous component, because fibrous component is predominant, right? So based on the growth of fibrous component, the microscope is divided into two patterns. One is intracanalicular pattern and two is pericanalicular pattern. Intra, is actually a misnomer. The fibrous pattern, the fibrous growth do not grow inside the ducts. It is called intracanalicular because the proliferation of fibrous stroma is so much that it compresses the ducts into slit-like spaces. Okay, so that's why it's called as intracanalicular pattern. Whereas pericanalicular pattern, the ducts retain their patency. They are usually round and regular. They are glandular, which are not compressed, and you find the connective tissue proliferation around these ducts. Okay, so there are two patterns. One is intracanalicular pattern, another is pericanalicular pattern. So what are the different types of fibroadenoma? They are juvenile fibroadenoma. This is a variant usually seen in young and adolescent women. with history of rapid growth. In this case of these cases of fibroadenoma, there is epithelial and stromal hyperplasia. Another one is a complex fibroadenoma, which is a fibroadenoma with fibrocystic-like changes, which is what we studied in part 1, right? Fibrocystic-like changes you find within the fibroadenoma with the presence of apocrine chains, sclerosing adenosis, and cyst formation. Why it is important to know this type of fibroadenoma? These fibroadenomas do have a slightly higher risk of subsequent malignancy. Another one is a giant fibroadenoma. As the name says, the tumor reaches massive size, that's around 10 centimeter in diameter. Some of the authors classify this type as juvenile type of fibroadenoma. Now, can fibroadenomas turn malignant? Simple fibroadenomas, the regular fibroadenomas do have a very slightly increased risk. It's almost negligible, whereas the risk of subsequent malignancy is higher in complex fibroadenomas. Whenever you encounter a fibroadenoma in older women or fibroadenoma in women with a family history of breast cancers. So you should be careful because these are the individuals who might have subsequent chances of developing into malignancies. So the next biphasic tumor or the stromal tumor which arises from the intralobular stroma is Phyllodes tumor. It arises from interlobular stroma, but it is less common as compared to fibroadenoma. They are benign and malignant. The benign ones, majority of them have MDM1-2 mutation, just like the fibroadenomas, whereas the malignant ones, apart from the MDM12 mutation, it also has additional mutations. For example, TERT gene. This is a gene which encodes telomerase. So you can find additional mutations when the Phyllodes tumor is malignant. And these tumors are variably sized. Some are very large tumors. Grossly, the larger tumors have bulbous protrusions because of the presence of nodules of proliferating stroma, and the proliferating stroma is covered by the epithelium. And the protrusions can extend into a cystic-like space or cavity. Okay, the characteristic feature is a whorled pattern with the cleft-like spaces that resemble leaf buds. And the name phyllodes is derived from the Greek, which means leaf-like. On the cut surface and even the microscopy, this pattern is seen, that is leaf-like pattern. Malignant phyllodes, on the other hand, very poorly circumscribed and locally invasive with infiltrative borders. Now, microscopically, the growth pattern typically shows exaggerated intracanalicular growth pattern. So we learnt about microscopy of fibroadenoma, right? That is an intracanalicular and pericanalicular pattern. This Phyllodes tumor microscopy is an exaggerated intracanalicular growth pattern with leaf-like projections into the dilated lumens. Let us understand this. Okay, and these tumors have, as compared to fibroadenomas, these have higher, in contrast to fibroadenomas, these have higher cellularity of the stroma, higher mitotic rate, nuclear pleomorphism, the stromal overgrowth, and infiltrative borders. So I have just placed in front of you these two images, right? One is that of a fibroadenoma, another is that of a Phyllodes tumor. So this is a classical intracanalicular type of fibroadenoma. Imagine a case of this particular lesion which has a massive stromal hypergrowth. It sort of develops into this histological pattern, which means there is a hypercellular stroma with compression of these epithelial spaces. This is an epithelial component, and what you see most of the places is the stromal component. Okay, and how do you grade Phyllodes tumor? Depending on the appearance of stromal component, Phyllodes tumor are divided into low grade or benign Phyllodes tumor and high grade, which is also referred to as a malignant Phyllodes tumor, where the stromal component is malignant, show highly pleomorphism, mitotic activity, and all those things you find in high grade Phyllodes tumor. The tumors in between low grade and borderline are referred to as borderline Phyllodes tumor. Now, the prognosis, Phyllodes tumor are likely to recur if they are not excised with wider margins. Generally, mastectomy is the treatment of choice for a Phyllodes tumor if the Phyllodes tumor are larger. So, lymphatic spread in Phyllodes is uncommon. high grade lesions, they recur. They are the ones which frequently recur, and they also develop hematogenous metastasis. And remember, whenever you have metastasis in these cases, the metastatic deposits contain only the stromal component. Till now we studied tumors of intralobular stroma, right? Now let us just quickly see what are the tumors of interlobular stroma. They can be classified as benign and malignant. Benign tumors include myofibroblastoma, the lipomas, and fibromatosis, whereas the malignant, the only important malignant stromal tumor of the breast is angiosarcoma. That means this is a malignant tumor of blood vessels. So that completes this part 3 of breast pathology series for undergraduates. In this, we learnt about the stromal tumors, particularly the tumors of intralobular stroma, the Fibroadenoma Phyllodes tumor, and just a list of tumors of interlobular stroma. So thank you for watching. Hit a like button if you have liked this. Do comment if you have any questions. Do subscribe and don't forget to share if you find this video useful. Thank you.